Good afternoon, good morning, and good evening for everyone who are watching this presentation. I'm glad to introduce our topic of presentation today, which is a literature review examining psychological interventions for depression in individuals with chronic illness in the US and China. I'm Zoe, and I'm currently a first-year master's student at Clinical Rehabilitation Counseling program at University of Wisconsin-Madison. And today I'm wearing a golden glasses. I also have a black hair, and I have a bench-ish hoodie with me.
Hi everyone, I'm Christine. I'm also a master's student in clinical rehabilitation counseling at University of Wisconsin-Madison. And today I'm wearing a black glass and also my hair is black and I'm in a red hoodie.
Hi everyone, I'm Alice Cui from Duke Global Health Institute, and today I'm wearing a gray hoodie with cats on it, and I also have black hair and wear glasses.
Okay. So before we start, I would like to say that for our presentation and project, we have nothing to disclose, which is good. And I would like to start off our today's topic with some statistics about chronic illness, which is our main population for the participants. So you can see the chart over the PowerPoint. This chart shows the number of Americans with chronic medical conditions from 1995 to 2030. So which it includes all the real life data and some estimation that people made. So from here, you can see a trend that over years, the number of chronic illness people population is keep increasing. And even on 2005, the data has already been as high as 133 millions of people in the US with chronic medical conditions. Moreover, globally, data has shown that 1 out of 3 people would experience multiple chronic medical conditions. Moreover, chronic illness is also very severe for elder population. The data also show that 70 million Americans ages 50 or older will suffer from at least one chronic condition. And if you see the chart on the left, this is the percentage of older Americans with at least one or more chronic conditions. And as the ages gets older, actually the percentage gets higher. And when for older adults ages 75 years or older, the percentage is even as high as 92.3%, nearly 93%. And if you see the right chart over here, this chart shows you the bar chart for comparing the prevalence of different chronic conditions for 1997 and 2006. And even within this 9 years, you can see that the amount of people falling into each chronic conditions is rapidly increasing. Okay, so if we know all those big numbers, why does it matter? It's because chronic conditions firstly will lead to poor quality of life. When people are in chronic health conditions, they're likely to have an impaired functioning of daily life and other aspects of their life as well. They will lose their independence and need to receive daily support and other support from others. And this also increase their depression through the poor quality of life in each aspect. And the depression and other poor quality of life issue will cause further suicide ideation and increase suicide attempts. And chronic illness will, as we talk about, it causes some dependence problems. It will further lead to many psychosocial problems. because chronic illness itself is actually a source of stress. The not only the symptoms itself, but also the finding and the chronic itself, and also the treatment process, they all cause different sources of stress. And people who are within the conditions, they would experience the loss of family and their social relationship, their body image change and body weight, and all the self-image change. And those different aspects, as well as the functioning impairment, will lead to different emotions like worriness, anger, despair, hopelessness, and anxiety. Because people might have random worry about their health conditions, and they have worry about their loss of social relationships, social participation, and other aspects as well. And people will also likely to be very angry about it because they cannot do anything about their chronic illness in many circumstances. And they might be angry of the people around them because they might feel lack of support in some ways. And it is possible that they might be angry about themselves not being able to do things and not being able to perform their daily functions as usual. They might feel hopelessness, which is closely connects to depression. They might feel like less meaningfulness about life, and their life has less goals. And for anxiety, because chronic conditions are over years and it has not have really adequate treatment plans for that. So they might have anxiety feelings whenever they think of their chronic conditions or when they have encountered some other psychosocial problems. Some other psychosocial problems includes self-withdrawal, loss of family and workplace status, as we've talked about, and then self-confidence decrease, because when they need to be dependent on others and cannot perform all the social and personal and emotional ways as usual, they might feel like their self-image are destroyed, and they have less self-esteem, and their self-confidence also decrease. In following their health conditions, there's usually fear of death and fear of their decreasing health conditions in general. And they might fear not being dependent, as we've talked about. This fear of dependence also connects with anger a lot. And we've also talked about the depression or depressive mood for patients with chronic illness. And we also talk about there's some social isolation or a lack of social participation for them as well. Okay, so we've mentioned a lot about chronic illness importance. So what is chronic illness? One way to put it is chronic illness is the condition not cured by medical interventions and will usually last for at least 1 year to see as chronic in general. And the chronic condition usually require periodic monitoring and supportive care in order to reduce the severity of the health conditions itself and to maximize the person's functioning and responsibility for self-care. And for this, our literature review and this project specifically, we're focusing on 5 chronic illness specifically, which include chronic obstructive pulmonary disease, which stands for COPD, diabetes, cancer, heart disease, and stroke. The reason for us to pick these 5 chronic illness is firstly because we found a study determined that chronic illness are responsible for at least 86% of the total number of deaths in Turkey. And then among them, the heart disease accounts for 47%, cancer accounts for 22%, And the chronic lung diseases counts for 8%, which is similar to our COPD because they all share some kind of respiratory issues. And outside that, we also found that depression is highly prevalent among individuals suffering from cancer, diabetes, heart disease, stroke, and COPD in both the United States and China. This study is very valuable for us because our project are also comparing the psychological interventions of those chronic illness both in the United States and China. And here's a little chart showing the prevalence of those 5 chronic illness in these 2 countries. And it is very interesting because in the chart we can see that the COPD and the stroke are particularly higher prevalence in the United States than in China, while in China, diabetes and heart disease and cancers are sharing a higher prevalence. And then this is like a point that motivates us to actually determine this 5 chronic illness as our main subject. And one also reason is we talk about the high comorbidity of depression with those 5 chronic illness as well. And for this literature review specifically, we're also focusing on depression as our outcomes. And why we focus depression as outcomes? We all know that depression or depressive moods are a very popular topic and very common in people's daily life. The World Health Organization actually found that 4.4% of the global population of people are living with depression. And I would say that this number is relatively small or underestimated because people who might not want to really disclose their depressive moods, or people might not really go through the medical model to be determined as living with depression, but rather depressive moods are very common in people's daily life. And also, depression is the most common emotional problems in older people. We've already talked about how older people have the very high prevalence of chronic illness. And also, depression becomes the most common emotional problem in older people. So we can see that there's so similarly, depression and chronic illness are 2 big challenges for elder population as well. Moreover, depression also causes functional impairment, decreased quality of life, and it will negatively affect the body's recovery from illness because of all the stress and all the other profound variables correlated with depression. Depression will also increase the rate of suicide, as we talk about the suicide ideation and suicide attempts. And depression will also increase the expenses of healthcare services as well. What is more important is depression commonly predicts disease-related morbidity and mortality. So we sense a very close connections between depression and chronic illness. And that's why we want to study depression and chronic illness at the same time. Okay, and outside of depression and chronic illness, another big word in our topic is psychological intervention. According to APA, psychological intervention is basically an action of a psychotherapist or any mental health providers to deal with the issues or problems presented by our clients. And the selection of the intervention is usually being determined by where our clients come from and the orientation of the therapist and the overall agency settings and the basic other nature or other characteristic of the client. So these are some general characteristic of psychological interventions. And for psychological intervention in this study specifically, we didn't actually limit the types of psychological interventions. Rather, we just want to include as many as interventions we can find in order to get more comprehensive data and to get some meaningful qualitative results. Why psychological intervention is effective? Why not just doing the pharmacological or other physical interventions? So you can see the picture over here. This is a meta-analysis related to the efficacy of psychological treatment for depressive symptoms in patients with medical disorders. And for this study specifically, they present the medical disorders actually has a more broader range, but I think it's still a valuable study to put here. They actually was analyzing 23 articles, and they found that psychological interventions are significantly effective for patients with medical disorders in regard of depressive symptoms. And they have the similar effect with the general population as well. So with all the factors in mind, we've already talked about the why chronic illness, why depression, why psychological interventions. Another big factor or variable in our study is we're comparing US and China. Actually, my team member, Alice, will talk more about this, but I will just briefly mention our motivation for studying US and China at the same time, which is we were all receiving education in the master program in the US, and we feel like it is important to bring a more broader perspective to compare another collectivist country with the individualist country. And we want to really study the research gap between those two countries together in order to really fulfill a better cultural disparity, cultural humility intervention, as well as both research and clinical side. We are also curious about how culture would affect the overall efficacy and if there's anything related to that.
So for this part, I will briefly introduce our research question for this research. So we want to explore what is the effectiveness of current psychological interventions in the US compared to the interventions in China in improving the depressive symptoms in people with chronic illness. And for the chronic illness, we are going to research for this project, which is COPD, diabetes, cancer, heart disease, or stroke. So for our objectives, there are three main learning objectives for our today's presentation and our study. So the learning objective 1 is to synthesize the existing evidence on the effectiveness and acceptability of psychological interventions for depression in individuals with chronic illness in the US and China, and to compare the similarities and differences across cultures. The second learning objective is going to explore the factors that influence the development, implementation, and evaluation of psychological interventions for depression in chronic illness, and to identify the best practices for cultural humility. The third learning objective here is to establish ethical and practical guidelines that direct the supervision and education of counselors by analyzing the interventions across cultures, and to enhance the cultural competence and sensitivity of counselors and supervisors. So here I will do a brief introduction on the conceptual framework and also our research methods. Since this presentation is actually on our current literature review and our preliminary research for a systematic review, in the future, we're going to explore more with the systematic reviews research methods. So here, I will briefly introduce about the conceptual framework for our systematic review and also the methodologies. So here, we're going to explain about the PICO model and also the PRISMA model as a guideline for conducting the systematic literature review. So for the PICO model is a framework used in evidence-based practice to formulate focused clinical questions and facilitate literature search. So what is PICO? The P is going to represent patient, population, or problem, and I is going to represent intervention, exposure, or issues of interest. The C is going to represent the comparison or control, and O is represents the outcome of interest. The PICO model helps to break down a clinical question into its key components, making it easier to identify relevant literature and synthesize this evidence. And for the PRISMA model, the PRISMA is an evidence-based minimum set of items for reporting in systematic reviews and meta-analysis. There are four phases of this PRISMA flow diagram. The first phase is identification. The second phase is screening. The third phase is eligibility, and the fourth phase is inclusion. And for the inclusion, I will introduce more in details in the next part of our methodologies. The PRISMA model aims to improve the reporting quality of systematic reviews and meta-analysis, ensuring that the readers can critically appraise and replicate all the findings. So it's our methodology part, which will cover the databases, inclusion and exclusion criteria, our co-evidence platform, and also our reviewer team. So firstly, we're going to choose the three databases for our future systematic review. The first one is PubMed, because PubMed is a comprehensive database of the biomedical literature that the US National Library of Medicine maintains. And it covers over 30 million citations and also all focuses on the health sciences field, which really fits with our research targets on the chronic illness. And for PsycInfo, it is a specialized database of psychological literature that is produced by the APA, the American Psychological Association. And it also contains over 4 million records from the peer-reviewed journals, which is also very important for us to know more about the counseling methods and our psychological interventions. So combining these two platforms together can help us to better understand how to research on the psychological interventions for people with chronic illness. And because we are going to do research on a cross-cultural study, which includes both US data and Chinese data, the CNKI is also a very important database we need to include. It is a Chinese research database covering all the journals and conference publications in Chinese. And it also although there are only 2 articles found in the preliminary research for our study, it is still very important for us to include this CNKI to our research database for the cross-cultural research. So here's basically a form for our inclusion and exclusion criteria. I'll quickly go through this. So since we are going to work on the population who is chronic illness, so for the inclusion criteria here, we're going to research on the people aged over 18 years old and also include both China and United States data. And we're also going to include 5 specific chronic disease, which is COPD, diabetes, cancer, heart disease, and stroke, as I mentioned before. And so for here, we're going to exclude those which may have influence on our chronic illness types, like the PTSD and also actually the anxiety disorders. We're going to exclude this kind of disorders to not affect our results on the depressive symptoms and depression. And we're also going to research all the articles after 2013. It's because 2013 is the year that the DSM-5 published. So the definition of some psychological disease extremely transformed. For example, PTSD are not as part of anxiety disorders anymore. So it may also affect our results from the different researchers. So for our systematic review, we're going to use co-evidence for our generally screening and also exclusion inclusion synthesis part. So co-evidence is a web-based software platform designed specifically for conducting systematic reviews and meta-analysis. It rationalizes the entire review process from importing and duplicating references to facilitating the collaborative screening, data extraction, and risk of bias assessment. And the confidence user-friendly interface and customized screening forms facilitate a very structured and consistent approach to data extraction and quality assessment. And the confidence also provides audit trails and real-time progress monitoring, allowing for the transparency and accountability throughout the full review process. And it also benefits our reviewer teams a lot, since we have three people in this reviewer teams. We are going to participate in all the process of the systematic review by this confidence platform. So we can see others vote for the articles which will going to be included in our research or not. So, and also it's actually a blindness selection. So we will not see how our partners vote for this. Are they voting for yes or are they voting for no? We will not see that. So this is also very important for us to do this systematic review in a very a standard and also structured way.
So now we haven't finished the systematic review for now, but we have done a very preliminary, we have done a basic literature review for the topic, and here are our results. Next slide, please. So for this presentation, we wish to present stroke and cancer as two pretty remarkable chronic illness in China. And we want to emphasize how these two chronic illness are especially a burden in the context of China and its unique culture. So for stroke, it is not just a health issue, it's a major economic burden in China. It stands as the leading cause of death and long-term disability, costing the country over 58 billion US dollar annually. And the combination of an aging population and a development healthcare system intensify the financial strain of stroke patients and their families. Also, China's national health insurance has been established and implemented in the past few years. However, chronic illness is different than the majority of illness because it is a long-term and money-consuming process. And the policy of China's national health insurance is that when the cost of disease get really expensive, you have to pay more by yourself to get more covered by the insurance. Besides, the range of insurance is 200K to 500K, which means if the cost of chronic illness exceed the limit, the patient have to cover the cost themselves. So apparently, stroke, chronic illness, especially stroke, is kind of a huge economic burden for all of the patients in China. And also, mental health challenge among stroke patients is, as Zoe have discussed before, is also a problem. Following a stroke, memory impairment is a prevalent issue, affecting over half of the survivors. This kind of impairment not only bring cognitive challenge, but also affects social interactions. This significantly increased the risk of depression. We have explored how research have explored how social resourcefulness play a vital role in maintaining the mental health well-being of stroke survivors, and the patient of stroke is having great burden during the stigma and discrimination that stop them from getting resource and getting help from the others. The word social resourcefulness means the ability of and the willingness of the patient to seek help. Since we talk about the patients have stroke having great burden due to the stigma and discrimination toward their memory impairment and cognitive difficulties, China, and we also have to know that China has been a culture with majority of collectivism. Therefore, the patient who feel being being a burden because of the memory loss and cognitive impairment is having a heavier burden, especially stressful burden in this situation. And also the burden of stroke is not only given to the patient themselves, but also given to the caregivers due to the social stigma. So the caregivers, including nurse and also the family members who grapple with managing are having difficulties with managing their emotion functions. And first for stroke patients, this is because the stigma level among stroke patients is really high, and it also influences the feelings of those caregivers. Therefore, the caregivers is not only carrying a huge amount of economic debts and burdens, but also facing the discrimination and stigma from people around them. So this kind of burden also give us a hint that it might be very important to look into the family therapies or couple therapies that integrate both patient and their caregivers together. So in conclusion for stroke, the mental health challenge faced by stroke patients in China are multifaceted and required more comprehensive support system. Culturally sensitive intervention are crucial to address in these kind of challenges. And we must recognize that the importance of providing support can be targeted to both patient side and their caregiver side. And it is also important to integrate the treatment between these two sectors. Next slide, please. So now we get to talk about cancer. So cancer is not only affect the body, but also takes an important role on mental health for those patients. In China, the rate of depression and anxiety is 54% and 49% among cancer patients, and it is extremely high. Shockingly, suicide rate is among these patients are 63 per 100K person year. So it actually surpassed the Western counterpart. And the lack of adequate psychological and social support for those mental health burdens faced by cancer patients also drive this situation worse. Cancer is also financially consuming for patients and their whole family. Even though China have implemented the national health insurance, it only covers a limited types of medicines, which sometimes do not include lots of specialty anti-cancer drugs and high-end diagnostic and treatment programs. Therefore, if cancer patients wants to use any specific medicines or treatment outside of the list, they have to carry the burden by themselves. Also, the cultural stigmatize and barriers for cancer patients is also pretty high, and that stop them from seeking help. Cancer and mental health illness carry stigmatize from the Chinese culture. This is because the fear of disclosure and emotional resistance hinder from seeking help, and unfortunately, stigma also pose barriers to early detection and diagnosis of mental health disorders among those cancer patients. And especially for cancer, similar to stroke, it is costing a lot of money and time for caregivers. And China has been known for a country that emphasizes filial piety which is the Confucian version, for thousands of years. This kind of virtue emphasized that people should care about their family and need to pay more attention and financial support to their family. And therefore, there's a stronger sense for cancer patients to being a burden in the family. And there's also a stronger sense of responsibility for caregivers to take care of their patients. The pressure from both sides provides sub-healthy mental health for both patient and the caregiver. Therefore, also for cancer, there's some family therapy, couple therapy existing and are especially useful for the patients having chronic illness in China. And also, cancer has been tested to be an extremely correlated factor of depression and anxiety. The reaction of the patients are especially reactive to diagnosis because cancer having unpleasant symptoms, and the patients are facing a fear of this kind of disease progression and adopt of having their lives. It also contributes to the symptom of depression and anxiety. And this is not only for China, but also effect and symptoms all over the world. And beside of that, what's more specific in China is that cancer patients are facing a challenge in research and clinical trials for the academia. This is because more Chinese cancer patients do not having trust in the clinical trials, and therefore there's limited opportunities to begin new trials tested on those clinical patients. And this made the literatures about cancer and mental health being very limited in the academic field. So in conclusion, for cancer, the mental health burden among Chinese cancer patients is more substantial and also multifaceted. To address the situation more effectively, we have to do more research and work toward reducing stigma and increasing awareness and also gathering more resources and academia efforts to support more cancer-related mental health studies. So this also made this systematic review so important. Next slide, please. So now we have looked into several articles by present in PsycInfo database, and it is striking that for the data in China, there are only 69 primary articles about chronic illness and mental health in Chinese database. So the treatment that have been addressed are expressive writing, family participatory dignity therapy, mindfulness, couple-based post-traumatic growth intervention, and peer support intervention. These 5 treatments are only the treatment that we are selected from the grand literature review, and we think these treatments are pretty unique because they're using a more modern version of therapy, and they also have an intention of integrating the client side and the family side. And next slide, please. And also we look into the US database and we find 512 primary articles about chronic illness related to mental health issues. So this is like a grander number than the China's database. So for the US, we selected treatment, psychological and behavior intervention, online adaptive cognitive training, the most classic cognitive behavior therapy, and they also have step care behavior intervention and collaborative psychotherapy and psychiatric care. So for the US database, the treatment are more varied, and they also considered about collaborating psychotherapies and psychiatric care together. Also, they have also considered about moving those psychological treatment online, which are also pretty effective moves. So comparing these two databases, what reminds us is that we need to compare more of the interventions to get an outcome, how these two systems in different countries are differs. And we also noticed that the articles are really limited in China's research field. And this also raised our awareness to call on more research on Chinese chronic illness and their correlation with mental health illness. Okay, next slide, please.
Okay, so for the general takeaway, we've already rambled for about 40 minutes, and there are some highlighting points we want to make to this point. So for the introduction part, we know the big number both in the United States and globally. So in the worldwide range, 1/3 of adults actually suffer from complex chronic illness. And this number even didn't count adults who just have one type of chronic illness, which can greatly exaggerate this number as well. And I also want to highlight the unique challenges for elder population because they both suffer from the common depressive moods and also the high percentage or the high possibility of getting one or more chronic conditions. And they are usually the group that we feel like, oh, probably having health conditions or like health related issues are really common, and it is no need to like pay extra attention on that. But we need to know that the health conditions problem doesn't equal to just problem. It is also kind of disability and chronic illness in general. And they also have some different intersectional challenges that people do not think of. And the third point I want to highlight is the high comorbidity between depression and chronic illness. And that's also the reason that motivates us to study depression and chronic illness together. I want to say that they do not come with just a directional direction, but there are more time dynamic and different social dynamic between the two, and each one affects the other, and so do other confound variables as well. And for the fourth point, Alice, do you want to speak about it?
So the general takeaway from the result part is that the burden of chronic illness on patients' mental health and their caregivers is actually a pretty culturally unique and culturally sensitive topic in China than the elsewhere in the world. So stigma and guiltiness is sometimes related to fatal piety and the collectivism tradition in Chinese culture, we have to get aware that this kind of culture is also having lots of development with the switch of trends to individualism in the whole world. But we still need to consider these culturally traditions and also be aware that this is also a continuously changing cultural background, and we need to think about this in a more dynamic way. And also, another takeaway is that we have to be aware of the economic burden due to the late development of China's national health insurance and elderly care. We also have to notice that for chronic illness, this is a more unique circumstance because the national health insurance have its specific policies that sometimes cut off the cost for chronic illness. So for the patients, they're not carrying the same economic burden than the person of other diseases. So this is also one thing to be aware of in mind.
So here comes to our discussion and implication part for this study. So how does the study address disability and rehabilitation counseling or counselor education related considerations? So firstly, the chronic illnesses and depression are highly disabling conditions that can significantly impact an individual's functioning, independence, and quality of life. Rehabilitation counselors play a crucial role in supporting these individuals with chronic illnesses and comorbid mental health conditions, such as depression, to help them achieve their personal, social, and vocational goals. Secondly, effective management of depression can enhance an individual's engagement, motivation, and adherence to rehabilitation programs, ultimately leading to the better outcomes for their physical illness. For example, the chronic illness and like the cancer or COPD. The cross-cultural comparison between the United States and China addresses the need for culturally sensitive rehabilitation counseling practices. Understanding the effectiveness of intervention across different cultural contexts can help rehabilitation counselors tailor their approaches and provide cultural responsive services to the diverse populations. And finally, this study can contribute to the evidence-based practice of rehabilitation counseling by identifying the effective psychological interventions supported by research evidence. Rehabilitation counselors can incorporate these interventions into their practice, leading to improved client outcomes. And for the next page, I'll explain how we can improve this outcome and how there are some recommendations can provided for the RCs to improve their counseling techniques. So here are 4 main recommendations for rehabilitation counselors and supervisors. So the first one is cultural sensitivity and adaptability. So RCs should be aware of the potential cultural differences for the clients in the perception and expression of mental health concerns, as well as the acceptability and effectiveness of psychological interventions. What does it mean by the perception and expression of mental health concerns? As Alice and Zoey mentioned before, the people from individualist culture and collectivist culture may have different expression of their mental health concerns. If they feel they have a excessive responsibility for their family and to be responsible for the family members, so they may actually hiding their mental health concerns because they are so concerned about the filial piety issues. And secondly is the continuous learning and professional development. So as the study may review, new or more effective approaches to managing the depressive symptoms in individuals with chronic illness, the RCs and supervisors should stay updated on the latest research findings and be willing to integrate evidence-based practices into their work. And that's actually what our research is going to do. We're going to review all the updated research on people with chronic illness in the latest 10 years and to see which interventions are the most effective one for people from different cultures. And the third recommendation is to have more interdisciplinary collaboration. So treating individuals with chronic illnesses and comorbid depression often requires a multidisciplinary approach. The rehabilitation counselors should foster a collaboration with psychologists, psychiatrists, and also some medical specialists, especially when we discuss about the rehabilitation plan for the clients. We need to consider also about their medication, their physical rehabilitation, and how this can benefit their independence and also vocational needs. And the last one, the recommendation is to have more client-centered approach. The rehabilitation counselors should adopt a client-centered approach, considering individuals' needs, cultural backgrounds, and personal preferences when selecting and implementing the psychological interventions for specific rehabilitation needs. And for this, I have a suggestion in the next slide about how to utilize the CFI model. So the CFI model is short for the cultural formulation interview, and it is an important model mentioned by DSM-5-TR and also designed by the DSM-5-TR to support people from different cultures. And this is the effective approach for rehabilitation counselors to implement a collaborative process that involves active client participation in understanding their cultural backgrounds, identifying barriers, and developing the cultural appropriate strategies to overcome challenges. As shown in the left picture of the screenshot for the CFI model, it has standardized question list and specific guidance for counselors to ask with a cultural sensitive perspective. So for example, on the left, here are some guide to the interviewer, which is our counselors, to ask about the questions. On the right side is the instructions to the interviewer, which actually how to understand these questions and how this can benefit the clients and how to perceive their cultural responses in this model.
So now, after looking at all of the theoretical models and recommendations, let's look at a case study in real life. So this case study is actually developed from one of the real case in the world, and we have changed and removed all of the identifiable data from the real case. So for the basic background, a 44-year-old white American female is diagnosed with breast cancer stage 2. And she was very worrying about her symptoms getting worse and worse every day. And she can tell the depression and the nervousness from her parents' face, from her family's face. And as an outcome for psychological side, she have developed depressive symptoms and experienced several panic attacks. So the impact of chronic illness on her psychological status is that her family also struggles a lot because of her cancer. So her family actually got really anxious, and she can feel that by herself. Also, the patient herself is feeling depressive, and she is afraid of the unexpectedness from her illness, and she get very anxious and sometimes feel panic attack when feeling the disease is getting worse or having a little bit of change. So the treatment plan for her is, first of all, chemotherapy. And the treatment is actually covered 90% by the medical insurance. So this is actually pretty relieving thing for her because she and her family don't have to worry that much about the financial burden. And for the psychological interventions, she have been trying family therapy to make her and her family feel confident about getting recover. And she also tried CBT, and her counselor also teach her to try cold water immersion to deal with her suddenly happening a panic attack. And as an outcome, this client can nearly fully recover from both chronic illness, her breast cancer, and also her depressive and anxiety symptoms.
Even though this case study is very unique and everybody has their own individual differences, we want to pick this case study because we think there are some general factors that are effective in this case that can also work on other clinical cases that counselors or counselor educations or educators or supervisors are encountering every day. The first one we identify is the combination use of psychotherapy and physiological interventions. I think as we talk about the client or the case person had ever used the family therapy, the CBT, and the chemotherapy, as well as the cold water immersion, and the effectiveness of psychotherapy and the physical interventions are actually hasn't been adding up. And I feel like um, it's never it's never worse to have more than one type of interventions being used together, which fits the client's personal background and their issues. What do you think, Alice and Christine? Do you have other thoughts about why this case are more effective?
I think there is also a very important factor is that, as you mentioned, she not only took the physiological intervention, but also have some psychotherapy. It actually needs a lot of cost to support all these treatments. So an appropriate medical insurance plan is also very important. In this case, I think the medical insurance plan actually covered her nearly 90% of the cost for her treatment. So it's also an important factor for the success of recovery.
And also one lucky thing about this case is that this patient got a very healthy family bond and support. So even though the family actually gone through a lot and they have been struggled for a long time, but like the family therapy actually helps a lot. And the patient also feel very grateful for having a supportive family that like telling her not to give up on the treatment, even though chemotherapy is actually pretty painful and have a very long time of recovery. So her family is a very important part for her to like hold on and like walk through all of the process.
Yeah, and when talking about the effective factors for this case, I feel like there are definitely more than what we've talked about, and I would also encourage whoever's watching this recording presentation just to stop and think or talking to like someone nearby like, about what else might be effective in this case, even though it's quite unique. And yeah, there are definitely other points that not been mentioned in this specific case, but we've also talked about in our presentation as a recommendation and as the our study's outcome that might be better help. The first one is the CFI model, which we mentioned the cultural formulation interview. In this case, even we talk about the ethnicity and the race and also the age, we didn't really know much detail about other stuff, like how's the social networks accept family, and if there are more complex layers among family as well. And we don't know about the social economic status and how the education level will be like. With the CFI model we've already talked about, I feel like the really structured question can really help counselors to and therapists to go through and really did do a structured interview or semi-structured interview of to understand a more holistic picture, to better design a more individualized intervention plan for this clients and other clients as well.
I think there are some important factors we need to consider to provide better help is to considering participating in interdisciplinary teams. I think in this case, we have mentioned about the chemotherapy, which may involve the medical doctors to provide appropriate treatment plans. But beyond this, our rehabilitation counselors and also some mental health counselors can also provide some psychological support to better help the clients. And also, I think in this case, it didn't mention too much about the clinical social workers, but I think it really helped a lot for the family counseling and the collaboration, especially when the clients are doing the treatment plan, like the chemotherapy in the hospital. And maybe it's also important to involve the clients into the treatment plan to with more different kinds of team members I didn't mention here. So it may better help the client to get a fully recovery from this chronic illnesses, not only the breast cancer, but also other illnesses.
Also something very unique for this case is that this person get like nearly fully covered by the insurance. And the insurance is actually a pretty helpful and unique resource that we need to get our clients get used to. So it is helpful for it is helpful for the clients to get someone who be familiar with the different kind of insurance plans for different populations, such as immigrants, students, and what are those plans for US citizens. It is a pretty unique one, and especially for those immigrants and like that they maybe do not have those resources as US citizens can reach out to, but there must be something that we can offer these more vulnerable populations. And also, it is really helpful if there are a lot of psycho education, as we know, like all the statistics and effective psychotherapies. If we can get those clients more familiar with these psychotherapies and know how to reach out, how to find ways to get help, that would be also helpful.
Yeah.
And also, I think, yeah.
Oh, yeah, Kristen, go first.
Okay, so I think also in this case, as mentioned before, this client is actually finally joined actually lead a CI support group. I think which is also very beneficial, not only for the clients themselves, but also for our rehabilitation counselors. It's important for us to collaborate with those CI support group and to get to know more about our clients' community. So this can help us to learn more knowledge about our clients and also the community we may possibly meet in the future.
Yeah, and I think you both mentioned all very valuable points, and I just want to appreciate and um I think, yeah, support group are very important in regard of not just involving the professional, but also bring all chronic illness people together and to allow not just a professional layer, but also a more like a peer layer, a more like real experiences around that. And I also want to say that the importance of psychoeducation in this point one more again, because we've talked about so many statistics related to chronic illness and the unique challenges for elder people. And we've also talked about some novel psycho interventions in both countries. And I hope those results or some takeaway can be something you can throw out to your clients or patients in the future, saying that, oh, I've come to this presentation, they have some points which is evidence-based. And yeah, I just feel like the presentation can probably could be a part of the evidence-based practice we have every day. And for the medical insurance point, I also want to highlight that I sense some cultural disparity and also the health disparity for this point. And I think that's why it's very valuable for us to do a cross-cultural comparison and to gain some more narrative or qualitative data related to this. I would encourage you guys also to think of how medical insurance or some more basic resources, accessibility of your clients, and how those factors work into the interventions and patients' behavior patterns. And what is more important is to involve your clients or patients to the treatment plan to better acknowledge their uniqueness and they are the expert of their life. And is there anything else you both want to add? Not really? Okay. Okay, so here are our references. And I just want to thank you all for watching this presentation and thinking and going through with us. And if you have any question at all, please just contact us through the emails listed in our presenters page. And finally, this presentation template was created by Slaggles, so I want to credit them. And yeah, thank you one more time for attending this presentation and have a good day.